All right, I'll call this Finance Committee to order at 9 o'clock. Roll call.
Commissioner Kuznow,
Here.
Commissioner Brown,
Here.
Commissioner Avery,
Here.
Commissioner Wayhill, Commissioner Ellenberg.
Here.
I need a motion to approval of the minutes for August the 2nd.
So move the minutes.
Support.
Any discussion? Hearing and seeing none. All those in favor?
Aye.
Opposed? Motion passes. We now set aside time for public comment to the committee. Is there anybody that, from the public, that wishes to make a comment to the committee? Is there anybody that wishes to make comment? Third time? Seeing none, we move on. Communications, proposed physical budget 20, well, I should say, resolution 23-101.
No, this is not a resolution, Mr.
It's
Chair.
not?
This is
It's just
a
communication?
Yep.
Okay.
I'm delivering the proposal.
So who's gonna do that, Crystal or you?
Crystal. Crystal's got all the checks.
Alright, so earlier in the year, I did a presentation that went into a lot more detail on the budget, so we won't worry you with that once again. But we did go through, with the meetings with each department and look for proposed cuts. I know a lot of you were at those meetings and part of those discussions. We were able to get the operations budget down to a net zero. Treasurer also agreed to kick in the DTR money of 1.5 million that we did not have at the onset of the budget process. So if you look at the information that was in your packet for the communication, originally in 2022, we had assigned $15 million of fund balance for capital projects. I know some of you were here to remember that. The 2023 budget was using $6 million of fund balance for those capital projects. The proposed budget that you have in your packet is going to use 8.5 million of fund balance, which is again from that assigned fund balance to put it in the capital project fund for the tower project. Also in that packet, the high level overview of the funds is from pages 9 through 15. So if you were gonna focus on anything, I'd focus on those, and then if you have questions, you can always reach out to me to talk through those. After this meeting, the proposed budget will be on the county's website for residents to access electronically. We also print a hard copy that we put in the clerk's office in case anyone does not have access electronically. They can stop in and take a look through that. The next meeting, the board meeting, there will be a public meeting for anyone to comment on the budget. And at that point, we'd be asking for you to adopt the adopted budget. I don't know if you had any specific questions going through that.
Anybody have any questions at this point in time? Go ahead.
I gotta get a higher, so I'm already
All
seeing
questions are done now.
Use
Yes,
both,
we're moving on.
both arms, please.
First thing, thanks for all the hard work, but I have a couple questions. My first one is that how many of the departments actually saw increases to their budget, not just standard increases we do, but increases as far as staffing or anything else like that?
Almost all of the departments went up. There was the negotiated increases in staffing, so all the staffing would have went up by their step raises plus that percentage that was approved by the board. Inflation is higher, so all of the non-personnel unfortunately also went up. Luckily, our revenue also went up to help cover that. So there were some departments that gave up some very large numbers unwillingly, so we didn't have to go back and do the difficult discussions on, how are we gonna get the rest of what we need to get to a good number. But yes, almost all departments went up in total.
Did we, if I may, Mr. Chair, continue?
Please.
Did we see increase in staffing anywhere? Is it that part of this
Yeah,
budgetary
so if
process?
you, the monthly board report that I provide has a summary of the departments and staffing that's been approved during the year that increased the level of staffing. So those departments would have additional staff.
As far, I'm sorry to clarify, in the budget, do we plan on any new staffing as far as any of the departments?
I think there was 3 positions for the board office. That was for a FOIA coordinator, organizational development, help me Josh, what was the third one?
And a communications person.
Okay.
And then there's some talks within fiscal services, but those positions would have to be created by the Board of Commissioners.
Correct.
So the funding is there, but it's not, those positions have not been created yet.
And we talked about it, and and I'm gonna come back to you just for a second.
So it's a placeholder for those funds can't be spent until the board approves those positions.
Well, and I understand, but right now, from what I understand is, we're dipping into fund balance to pay for the building down there.
Correct.
Okay, so, for me, and that was decided, but against what I wanted to do, but that's fine, we're moving forward. But, that being said, we're pretty much at a net zero right now. And through the year, people are gonna come to us and they're gonna ask for
Sure.
this or that, or things are gonna come up and pop up.
Yep.
Is there any money put in there for emergency? A roof, or
Yeah.
guess what, we need something else, and
So
what is that
actually-
amount?
Yeah, and Crystal can maybe speak to the exact dollar amounts, but at our next board meeting in September, we're actually going to start, we're creating a capital fund, and we're gonna start funding that. So she's gone through this year, and those departments that had maybe vacancies for a short period of time or a longer period of time, depending on the department, we're gonna sweep those funds back, and we're gonna use that to start a capital account that will start to address some of those long-term capital needs that the county has. Do you know that number off the top of your head, Crystal?
As soon as I get the adopted budget book in, that's my next step. So we have had a lot of departments that have had vacancies in fiscal year '23. So obviously it's much easier for us to quantify those savings, take it out of their current year budget and put it in that capital fund to start funding, to your point, some turning into emergent needs. Our plan would be in '24 to start looking at that on a quarterly basis, and if there's vacancies, take those funds and put them into that capital fund. So we're not trying to rob Peter to pay Paul in general fund if those things come up. I wanna say, just by the initial looking at everyone's files that have been sent to me, it's probably going to be close to $1 million for '23. So unfortunately, the departments have had vacancies, but fortunately, it's going to give us some extra money to put into that capital.
So that'll be seed money, that in no way covers all of our capital needs across the county, which, we're gonna be bringing forth that capital improvement plan for you guys too. That'll require you to make some decisions on how you wanna move forward, in terms of operations. But, we hear what you're saying at every other meeting about we need to start setting aside dollars to meet those needs so that we're not constantly dipping into that fund balance, and we're trying to do that.
If I may continue.
Continue.
Has any thought been given also for staffing though, because we've run into issues throughout the year where we need to increase staffing, we need to increase overtime because of a loss of an employee or so on and so forth. I know at the sheriff's department, they've had a lot of that, so they at times need more, an influx of cash to come in.
Yeah.
And is there a fund set aside for those dollars also? Have we talked about that?
Yeah, so no, I think, the sheriff's office, and he can maybe speak to it, or Crystal can speak to it better, it's not a staffing, a funded position issue, it's getting people in those positions, right?
Yep.
So we can add more and more staff to various departments, but it's a matter of plugging them into it. If we're not filling the holes we have currently, adding more staff isn't gonna make it any easier.
No, I'm sorry, I wasn't communicating clearly, I apologize. What I'm trying to say is, let's use this as an example. Let's say they are short-staffed, so they have to have more people work more overtime than they anticipated. Or some other example, some other department, police department says, hey, we're gonna pay another 20 grand, and all of a sudden all of our guys are going someplace else, and now he's gotta make up for that, or the department has to make up for that with overtime.
So typically,
So-
if that happens, we can take money out of the salary line and put it into overtime. It's just a reclassification of that budget.
So there's,
So like in my
there'll be
office, I have a
no
vacancy,
increase of
I mean-
funds
What's that?
needed from the general fund then?
There shouldn't be.
Haven't we
No, if I
approved
have
stuff
somebody
like that
working
before
overtime
though?
to cover,
A vacant
Some
position,
vacancy,
you
it
can use
shouldn't
that
be,
vacant
yeah.
position funding.
I should be able to take it out of the vacancy and regular salaries and put it into overtime.
Well, I'm not real smart, so just bear with me. But the fact is overtime is more than regular wages. And generally, the jobs we are losing are not at the same level of the guy who's having to pick up the overtime. So that wage is not there, so
But you're also not paying benefits to that vacant position either, and there's a cost associated with that.
obviously, we see the benefits every time and I will discuss it when you bring up your 3 employees you wanna hire. The fact is guess what, you can start 55 and you're 100
Yep.
before you know it.
Yep.
But the fact is that even though this all happened and the sheriff's department is just one example, the prosecutor's office could be another one, that if we had that rainy day fund for staff through the year in our budget, it would be helpful. Because then we're not saying, hey, we're taking this, when out of the general, I ask the questions, where's this coming from? We go 10-10, and we go, oh, general fund.
Right.
And then it's that debate. And then our residents know, guess what, we're being a little more sound. And that's why when we're at a net zero and you guys are gonna come to us for three new positions or how many new positions, I take a step back and go, yeah, things are good right now, they look really great, but guess what? It's not, number one, we're not always gonna ride this high, we've been riding this high for years.
Yeah.
And then we've gotta come back down, so it'd be nice to have those funds sitting aside, just like we do for capital
Yeah,
improvement.
so I think
or
to
that's a
that
plan.
point, so the budget resolution will include wording where you're saying we're gonna maintain a 15% fund balance, right? I think it's about 15%, which is what, 2 or 3 months worth of operations. It'll be a policy decision on the board as to whether or not they wanna continue to just accumulate cash or if they want to use that cash to meet needs within the organization.
Well,
So you're asking, do we have fund balance? Yes, we have fund balance
Yeah,
set
I know
aside that is for those specific purposes. If you want us to rename a portion of that fund balance to something else, we can certainly do that.
well, it looks better than you're constantly digging into your fund balance, and you say, we're gonna dig into fund balance, we're gonna do fund balance. And as someone who used to be a resident, when every time I hear that, I would go, oh, great, where, like you always tell me, oh, it's coming from that's from the IT account.
Yeah.
Well, the IT account's just funded from the general fund, but, that's,
A part of it, yeah.
yes, so you and I would have the conversation, I said,
Potato.
just a different pocket, same pair of pants, so the thing is it just would see, one, I think it'd be smart to have that sitting aside so that's what it's gonna be used for each year, that's rainy day plan. And then also, it would help us kind of have a barometer of where that a more accurate account of where that general fund balance is. Now, I don't, the state regulates, I think, how much minimum we can, is there not a minimum for general fund?
No, that's a policy decision by the board.
Really?
There's just recommended.
Is it at the
measures.
town, is it at the
It's
township level that they
The
do that?
GFOA makes recommendations, but there's no specific
Even at the
law.
township level, it's just a
Really?
recommendation.
Gosh, I remember it different, wow, all right, well, that seems, 2 to 3 months doesn't seem like a lot of operating with.
Well, and the
that
reason they do that
cash.
is, each entity could have a different metric depending on how big your overall budget is dollar amount wise, because, 10% to Thetford Township might be very different than 10% to the county, so that's why they don't put a standard percentage in there.
Do you have an idea what healthy counties are running at? What percentage they're
Well,
running
that's the
at?
metric is 15% for most entities.
What's it-
So, I'm sorry,
What's an unhealthy county running at?
below that.
Negative.
Alright. Like I said, I would just like to, maybe if there was room to work it, put something in there, but
And we
I've
do
got
look
the
at
chair, so.
trends and needs, so the sheriff department did increase their overtime budget for 2024 over 2023, knowing that they have had those vacant issues and trying to help them, we don't try to hash and slash to make it difficult on departments, we do try to keep it realistic, but also realize there's sometimes savings that could be leverage that may not be tapped into, and we try to push them more on that, each department, not just the sheriff, I'm not picking on them, but.
No, and that
All of
was
the
the intent,
departments.
that wasn't the intent, but it's very important, and those are just examples that we've come up with, so.
Sure.
Alright, well,
And I think that's a good point, what she said, last year we saw what we were spending in overtime and what that looked like, and we made that adjustment in this year's budget so that hopefully we're not having to come back to the board and say, well, we need another appropriation from the general fund to make these, to cover these unexpected costs. So, from year to year, we try to adjust and meet those needs so that we're not coming back for an additional appropriation. So I think that we're trying to do what you're asking us to do, and maybe we're just speaking in.
no,
I think it's optics is what Sean is talking about.
yeah, well, it's optics, but it's also, the fact is that not every department can foresee that,
Right, for sure.
from there, and so you can plan all you want, but if you had that set aside and it was there, because.
Which is why we set aside that, that minimum fund balance so we can make that, and then next year we'll make adjustments in the budget to say, we're gonna have 15% in our fund balance, and we're gonna work within the budget to meet the needs of those departments.
Where is we as a board, where have we decided that is our magic number for fund balance?
So that's the recommended number, that 15%, you guys will have to debate that as part of that budget resolution. So if you want it to be 60% or you want it to be 6%, you have to you do that through voting on your budget resolution.
Yeah, if I may, Sean, we've talked about that throughout the years of doing that as a policy, and we've never done it. And so we need to do that moving forward, make a policy of 15% or 20%. I was always taught 20%, but we've had that discussion, why 15% is fine. But that's how the fund balance works, is that's why it's theirs for those unexpected costs. And you can call it something else, but then you make the adjustment the following year. Well, you know, we wanna, if our thing is 15%, then the following year, if we're below that 15%, we have to make cuts to make up for that. Make the adjustments, yeah, but, you know, cuts is the wrong optic. But at any rate, did you see what I was
Yeah,
saying?
no, I
there?
understand, I understand what you're saying.
Yeah.
Like I said, the thing is when it's in general, it can be spent on other things if a crisis occurs. And if you have multiple crises going on, then guess what? Sometimes the first one to get to it is the one that gets all the attention. So I just, like I said,
Right.
and they were a full board, I thanks everyone for the discussion. And I know everyone's worked hard on this, I've watched it year after year. It's just a concern I have that I always like to have everything this much set aside for this, this, and this, because, you know, when things start going crazy like they did during COVID, we're spending dollars even before we had that money. Like it's going out of style. And if you are tight someday and to set up future boards, I just think if you are on that 15% cusp, if that's where everybody agrees to be your 20, and then you don't have that set aside, then it gets really easy to, you know, go below that. So that's, but I know whatever has worked at, I appreciate it. I just want to make sure all of our departments are covered and we have those things come up. So, thank you. Thank you, Kristen. I'm sure I'll bug you with some other questions later, but thank you.
Does anybody else have any questions or comments?
I just have one
Sure, go
question
ahead.
or comment. I would feel more comfortable with a 20% cushion. 15% is, I realize that's the minimum and maybe a comfortable area, but 20% would be better. Are we on track right now for the 15% cushion?
So what I was going to say is, we are on track for the 15%. So what I do is take where we were in 22, what we're budgeted to use in 23, and then what we're budgeted now, if you adopt this budget to use in 24, to make sure we would be at that 15%, and we are. We would
Okay.
not be at the 20%, so if you adopt that, we would have to go back and make
What's
cuts
an additional
to get to
5%
that.
mean? What is an additional 5%? What is that dollar amount?
I would have to look, I don't know off the top of my head.
Numbers are hard.
Well, when
I know,
I look at so
I'm
many
just-
numbers a
It'd
day,
be about
I
$5
can
million.
quantify it for you, but we would have to go back and make cuts to get to that 20%.
Okay, so, and I,
Yeah, on a $100 million budget, 5% is gonna be about $5 million.
okay. Okay, well, that would be something, I mean, I'm not saying for this year, but something to work toward. I think Commissioner Shoemaker's point was well made, and echoed by our chairperson. But just keeping in mind that the ARPA monies, I've seen them starting to disappear now, and so we're kind of be on our own to really shore it up and make sure it's a solid budget, so.
Yeah, and once we get in the new tower where we can start seeing the savings from, you know, consolidating space, I do think we're gonna have some savings there that will help us get back where we wanna be. It's just, right now, it's difficult because we're paying for that and paying for other things at the same time, but
Yeah.
I really think that will help.
Yeah, thank you.
I think that's a good point, Commissioner. You know, we're using $3 million of ARPA in this year's budget. That, you know, that dollar amount won't be there next year, so we do have some struggles as we move forward. I think that it's a good idea also to maybe, you know, 15% this year, working towards a 2 to 3 year expectation that we'll be at 20%.
Yeah.
And bite that off in smaller
As a
chunks
goal.
versus, yeah.
Yeah,
And maybe we should put that on the future agenda rather soon to adopt that 15% or 20%.
Yeah, we'll
And
put,
do that officially,
yeah,
so it is policy.
we'll officially adopt it as part of the budget resolution, and we'll work, you've got some draft policies that we can incorporate that kind of increase every year until we get
And
to
that'll
that
all
certain
go into
level.
the general fund.
I'm sorry?
It'll go into the general fund, not a
It's
rainy
a
day
general
fund.
fund.
Yeah.
Does anybody else have any comments, questions? Seeing none, moving on. Is there any old business? Hearing none, new business. Resolution 23-268, approval of a request by Genesee County's IT department to travel to MIGA GMIS, the conference dates of travel are September 10 through 13/23. Total cost for travel not to exceed $2,950.
So moved.
Support.
Is there any comments or questions?
Is Mike here? Who's
I
going?
don't see him right now.
Where was it at? I didn't see that.
Yeah, it doesn't say
It
where.
doesn't say, I don't know. And I don't know how many people are going.
Not
We
very
can,
many.
let's just pass it through and then we can ask those questions.
What's the question? I'm sorry.
Where's it at?
Where's it at and how many people?
I think it's 2 people, and the menu says. It's actually for 4 people.
Okay. Far.
No.
I'm not sure the exact location, but I can get that. Boyne, it's up in Boyne.
Oh, yeah, I do remember seeing that.
4 participants going to my GMIS conference in Boyne in September.
Okay.
Yep.
Any other comments or questions? All those in favor?
Aye.
Opposed? Motion passes. Resolution 23-285, approval of a change order to increase existing purchase order 22-05375 not to exceed $50,000 to allow animal control to continue to provide testing and medical supplies.
So moved.
Support.
Does anybody have any questions? I do. The $50,000 that's gonna be the total, or that's what we're adding to it?
I believe that's going to be the total, and they're moving money around within their budget to meet that.
Okay, any other comments or questions? Hearing and seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 23-291, approval of a request to create, post, and fill a health educator position at Genesee County's Health Department. The cost of this position is grant funded. Does anybody have any questions or comments, or do you want to explain,
So-
Dr. Hackard?
Support for question and discussion.
Okay. Dr. Hackard, if you would, please. Go ahead, Commissioner.
Can you tell us about the position?
Oh, yes, this is a hearing vision position. And it's for our hearing vision programs. The numbers have gone up because many children were not addressed before. So we have this position, and it's been going up in general. It's for the whole county.
When you say gone up, can you give me some data?
In terms of the number of children being screened, it's in the tens of thousands. So no, I don't have the exact number. But it is something we have been understaffed since before I started. And this is a position that has been trying to be utilized for quite a while. And it is funded already by our current budget year and the going forward. It's something we had a vacant position for.
So have we had this hearing and vision position before in the past and it disappeared or?
Right, they transferred into a
Okay.
different position
Okay.
within the county, so this is a vacant position now.
Is there any
We can get you
comment?
that specific data before the next board meeting.
Okay, thank you.
Yeah,
Is it, go ahead.
I think it's like 40,000 children, but this is a position that is critical because the person who was in it moved to a different spot.
Anybody else have any questions?
I do. So basically, are like for the hearing and vision, are the schools still referring people, or they have to come to the health department for this specific?
We go out to the schools
Okay.
and do the screening at 3 or 4 different spots of the child's education career. Between 3 years old, preschool, and 9th grade. So we go out that way.
Okay, that's what I wanted to know. Okay, and that cost or that position would be doing that or that department?
Right, this is a position was already there. They
Okay.
just transferred into a different position within the health department. So it's just a refilling the same position.
Okay, all right, thank you.
I think the confusion was it says request to create a position.
It's the same one we've had.
Okay.
I do have a question of Freeman. I thought we passed, or we told the directors of the various departments that they didn't have to come to us if it was just filling that existing position.
My understanding was that this was a new position.
I was told it's not,
Health educator position?
the health educator position for.
Can you come back up, just so you can come up? Michelle, can you come up so they can pick you up on the mic?
So with yes, this will be a new position for this group.
Do you know
And
the
then there's
numbers?
another health for hearing and vision.
But in the discussion, it does say this, replacement, transfer. I think we might have used the wrong form. We can also get that.
Okay.
Yeah, why don't we hold off on this one?
So you wanna table it to the next
timing is
meeting?
kind of critical
Yes.
because this is when we need to have this with school starting.
It was, the
So
person
the
was
health-
transferred into,
We used the wrong form.
I wait,
So is this for the medical marijuana piece,
No.
or is
no,
this?
the
hearing
medical
vision.
marijuana would absolutely be a
That's
new health
next.
educator, because that's new money.
Yeah. It's the hearing
So
vision.
this is the new one, if the hearing and
Hearing
vision one
It's
is
a
probably a
transfer.
document review that isn't on, this is the medical marijuana piece.
Okay,
That
Which
one's
is
a
a-
document review, that's not on the agenda, the one that's on the agenda is for the medical marijuana.
okay, and that is new.
Yeah.
That's absolutely new.
Yeah.
And the number is we verified, it was, it is, the number on there is correct because it was changed in the budget system.
Yeah.
So it used to be a different program and they changed it
Yeah.
to this program or created a new one.
So maybe we can talk about what the medical marijuana health educator is doing. That was the confusion, is that other
That's-
one went through the document review process because it was a vacant position.
Yes.
This one is a new position that deals with the medical marijuana stuff.
Okay, this is not about the hearing.
This is not.
And the hearing one will
The
just go through.
hearing one is because it was a previously budgeted position.
Okay, so we don't have to vote on that, okay.
This one is for medical marijuana.
Could you
So I can
explain that?
probably
Yeah.
speak to that.
Sure.
Okay, so.
Michelle's saying in a non-pejorative way.
So the medical marijuana is position is going to focus on education and new information that will be provided to pregnant mothers, expecting mothers, breastfeeding mothers, in the Healthy Start program as well as the WIC program. So what we're finding from our information is shockingly a lot of mothers are utilizing marijuana as well as tobacco during their pregnancy. So we realized from the things that we're looking at that we need to shift some of the focus and try to reach out to them, working with the social workers as well as the nurses at both our hospital programs. So that would be Ascension and Hurley. We're going into the homes, we're doing home visits. So we're definitely looking at a lot of the information and realizing we have a lot of mothers that are smoking marijuana as well as cigarettes. And unfortunately, what we're also finding out, which we may have to reach out to a different agency for help with that, is that most of them are doing it as a result of what we're finding out, looking like anxiety and other mental health problems are all connected with this. So we need to look on our messaging and how to deal with it and start and do now have a specific piece on medical marijuana, and we may find that some may not be medical as well.
So this is a grant from the state using the medical marijuana money that they collect.
Yes,
Okay.
That question.
yes.
So basically with this marijuana, you said that it's basically they're using it because of anxiety and things like
Well,
that.
that's what we're finding, not all.
More than likely.
But a lot of them were already utilizing it for, medical conditions like depression and anxiety and, depression might not be, but we see anxiety and other mental health issues in there.
Would there
and
be
they're
something
working
in
with
place
social
for them to handle that? If that's the reason they're using this, is there gonna be another way to handle
We've
like?
applied for 2 grants to try and do that. We have not been successful with those 2 grants because they were awarded to other agencies in
Okay.
the county. But it is something we're working with many community groups to do that. And it is something that I can actually also say that with our fetal infant mortality review program, I am seeing we've been doing it for 24 cases, so 1 year now, so 2 a month. There's been a significant number of people who had been using marijuana, and it doesn't mean it's the factor at all. It's not even necessarily a contributing factor, but it is. You are seeing that in mothers who have lost a child either at birth or within the first 12 months.
Is there something that GHS could come in and help like with the mental issues on this? If it's something that is, you
They
know,
may be able to, we may be able to, well,
To reach out
part
to
of
them.
this program already with the Healthy Start program and with WIC, because our WIC program also works with our Healthy Start program. Oftentimes, the mothers may be a part of both programs, but not always. And let me also say that the Healthy Start also includes fathers, too, because it's, it's a part of the family. But a referral process is already a part of that process. We work with the hospitals, and as a part of that, it's the social workers and the nurses that are going into home. And then we also have our community health workers that go in and try to make sure we're providing the services and referring them to the right people. It could even be food security. There are a lot of things that we're looking for and trying to find out what type of services they need. It may even be they don't even have a phone, and we may be trying to find a phone. So there's lots of referrals as
Okay.
part of that.
all right, thank you.
Is there any other questions or comments? I just have one to Josh, so I'm assuming we're gonna approve this, but when it goes on to the full board, there'd be documented, be a resolution that says.
The resolution does say that, yeah, there was just some confusion because they've also got a document review for a same type of a position. Not the same function, but the same title.
Okay.
So the resolution that's before you is correct.
Okay. All those in favor?
Aye.
Opposed? Motion passes. Resolution 23-297, forwarding to receive and file a copy of the paid county bills for the weeks ending 7/23/23, 7/30/23 in the amount of $9,429,806.91. Support. It has been moved and supported. Is there any questions or comments? Seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 23-301, approval of a grant award from the Michigan Department of Health and Human Services in the amount of $748,930 to provide for Genesee County's weatherization assistance program. The budget for this grant is attached.
So moved.
Support.
Is there any comments or questions?
Yeah, could
Go ahead,
we
Commissioner.
explain, do we ever have a breakdown of exactly how this is, money is used? Like for the weatherization, how many customers and stuff that we, touch?
Good morning.
Good morning.
Morning.
Yes, those dollars are expected to probably assist in the DOE program of probably 59 homes throughout the year.
59 for the total amount. This includes probably the employees that do this job
Yes.
also?
Yes, it does. And so we have 2 different grants. This is our DOE, and we have a LIHEAP grant as well. That's about maybe 12 or 13 homes that's expected out of that grant.
All right,
So
Thank you.
100 homes out of the 748,000 plus, that's about 7,948 that you're spending per home on the average.
Okay, 100 homes, I'm sorry, repeat
You said
that one.
there's 100 homes. She asked if there's, how many homes that this covered.
About 59 homes.
Okay, so it's more like 14 or 15,000 that's being spent per house on
So
average.
the average cost per unit should not go over, for this year, $8,009.
Okay, so the rest is going into our administration of that.
Yep, salaries and all those fees, including materials also.
So a little over, or a little less than half is going towards just administrating the grant.
And I would have to just really be looking at it in front of me, but
I'm just talking in generalization.
yes, I would agree.
All those in favor, is there any comments or questions anymore?
I mean, with that employee, I know you probably don't have it all, like, you know, because if half of it's for administration, there has to be.
That's a lot.
We currently have a couple positions posted. One we're about to fill for a retrofit. We're actually gonna come back before you guys very soon to move 2 part-time positions to full-time positions per the state. They're really pushing us to do that so that we can try to get out of a short staff situation. Right off the top, we have a director, we have an assistant director, a supervisor. It's probably 7 or 8 employees
Do you
that
have
will
a
be getting
waiting
some of the a percentage of the dollars will pay their salary.
Do you have a waiting list for this program too?
Oh, absolutely. Our weatherization program, it always keeps, there's 59 homes in a year, but we have hundreds of people on the waiting list, unfortunately. The dollar amount sounds really high, but when you break it down, the state requires a minimum of 59 homes at that ACPU of about $8,900, $9.
And the waiting list just moves up, they don't have to apply every year when it comes out?
So they'll go on the waiting list, and then when we finally get to their name on the waiting list, then the documents required and the update for whatever they need will be asked for at that time.
All right, thank you.
Any other comments or questions? Seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 2311, forwarding to receive and file a copy of the third quarter investment report.
So moved.
Support.
Is there any comments or questions? Seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 23-314, approval of a request to create, post, and fill a health technician position at Genesee County's Health Department. The cost of this position is grant funded.
So moved.
Support.
Is there any comments or questions? Seeing none, all those in favor?
Aye.
Opposed? Motion passes. Resolution 23-317, approval to create, post, and fill one public health nurse position.
So moved.
Support.
Is there any,
For question.
okay,
Can you talk about the public health nurse position and why there's a need for that at this particular point in time?
So, yeah. So I think most people have seen the really dismal statistics on immunizations for children after COVID. It was decreasing a little bit as it was, but now it has gone down more, and that's for a multiple, number of factors. One is early on saying stay home with the pandemic, don't go to medical facilities. So we have additional work to be done in the community. Our numbers had gone down. They've gone down roughly about the same as everybody else in the state. And this is actually then to do additional outreach. We have 52 vaccine for children providers that our nurses work with those providers in the community. And they go out and give support and also help facilitate education on some of the new vaccines. There have been a lot of new vaccines in the past 10 years. We just aren't able to keep up. And additionally, on top of that, we have an increased request for number of waivers. And the waiver education is required by the state as part of the immunization program. So you can't keep people waiting too long to get their waiver that they need to start school. And that is an enrollment process that keeps on going because it's also very strongly affected with pre-kindergarten, daycares.
So there's a sense of urgency with this too because school is starting?
Right. But not only that, but because we are expecting to see the outbreaks that would go along with the decrease in immunizations across the state and across the country. It's not just Michigan, not just Genesee County, not at all local. It's actually something that's happened nationwide, which is why we've seen like measles outbreaks that you have in Ohio. There's and even polio in New York. So we're seeing those things, and we want to make sure children are vaccinated.
I'm just surprised there's no grant funding available for that if that's the trend that's going on. And it's such a broad trend. There's no grant that can be secured for this kind of a position.
There is not more than what we already have. And that is something that they're trying to address right now with the budget, the state budget, and also some of the nuances that are remaining from the previous legislation in the state.
Dr. Brown, this isn't an additional expenditure, it's included within the budget, they're using funding that's already exists.
Okay.
Answer that.
Is there any other comments or questions? Hearing and seeing none, all those in favor?
Aye.
Opposed, motion passes. Resolution 23-371, approval of a request to amend Genesee County Superiority Court
So moved.
Bureau of Justice Assistance Federal Grant Budget.
So moved.
Any comments or questions? Seeing none, all those in favor?
Aye.
Opposed, motion passes. Is there any other business? Seeing none, we are adjourned at 9:40.
Government ops will be next.
Okay.
Yeah, keep it going.
Okay, we'll start our Government Operations Committee meeting, call to order, roll call please.
Commissioner Avery,
Here.
Commissioner Shoemaker,
Present.
Commissioner Davis,
Here.
Commissioner Kuzma,
Here.
Commissioner Ellenberg.
Here.
Okay, next we have approval of minutes, I entertain a motion for approval of
Move it.
minutes. I'll
Support.
second. Okay. Any questions or discussions? All those in favor?
Aye.
Opposed, motion passes.
Mr. Chair, under communications, the sheriff did ask to address the committee concerning the Flint City lockup.
Okay, we'll get to that after, opening up for public comment.
Sorry.
I got you, man. I got you.
Had you rough.
We're opening up for public comment. Public comment open for once, twice, and public comment now closed. Now we'll open up for our communications, which I believe our Sheriff Swanson has the communications for us.
Sensitive that we're in government ops, I do want to congratulate Crystal. I've worked with a lot of fiscal services and controllers. You are the very best. The fact that when you don't know something, you'll say you'll find out. We didn't always get those answers before, and a lot of misinformation was given. So to you and your whole department, phenomenal job. Also want to publicly invite the board of commissioners and everybody, obviously Back to the Bricks is in full gear starting tomorrow with the cruise, Friday, and then Saturday. We have been able to take advantage of the real estate at 5th and Saginaw and host for the 4th year in a row Deps and Dogs. And it moved all the way now down almost to I-69, where that whole front of Saginaw Street will be vintage public service vehicles, from fire trucks to police cars, and it's a great day, and the weather's perfect, so I invite everybody to be out there, bring your families. Transitioning into something that's not so optimistic is, although the budget was successful, I was cut a $2 million reduction from the state. When you look at an $81.7 billion budget for the state, there's a lot of folks that compete for funds across the state. Our Appropriations Committee Chair is Representative Amos O'Neill, is a dear friend of mine. And he gets pressure from a lot of people throughout the state. The city lockup is going on the 12th year, and that funding comes from the state, for the record. And it's directly given to the county, and the city of Flint is a signer. And at that point, you're well aware of our commitment to use that facility, which will end on September 30th, just in a few weeks. But the 23-24 budget, with that reduction of $2 million, leaves us with $2 million to fund the city lockup for 23-24 and fund the tether program that the state reimburses Genesee County for. Allows me to balance the population in the jail, to keep people on tether, but not overcrowd the jail. And that's on average trending about $350,000 per year that the state reimburses the county for people that aren't able to pay for tether, but yet have the right in a judge's order to be on tether. So that is a must. Now that tether part for the board has nothing to do with the city lockup. It's just the same funding source. But the city lockup that has 22 positions, 2 certified physicians, 4 sergeants, and the remaining deputies, you can't operate it having a $2 million cut. There's probably a lot of reasons why they reduced that funding. I can only speculate on some of those, but the reality was that it was signed into law on the 31st of July, and that's what we had to operate. we had already planned, and I had met with the mayor, and you have been involved in these conversations, that running the facility over there at this point is not the best use of money and resources. So we had already agreed in the contract language to move those operations to the Genesee County Jail facility. It's a lot more streamlined, it just makes most sense. Without knowing that we got reduced in funding, it was good foreshadowing, because that truly is the only way to continue the operation. Knowing that I have to take $350,000 out of the $2 million that's already been signed off, that leaves me with $1,650,000. And with that, we are going to continue the operation to city lockup, but we will eliminate 5 deputy positions and 1 certified patrol division position out of that 22 people personnel roster. We are going to make sure that the sergeants that are in those positions are not defined benefit sergeants, because as you know, that is a significant cost when you're looking at a sergeant, because of the charge of percentage increase for defined benefit is sometimes 125,000 more than a defined contribution sergeant. So we have some move there. We've reduced overtime in that budget. Since it's already in the jail, we can cover it with other places. We don't anticipate doing that. But I rarely do I have to come and say we have been reduced, and it has nothing to do with you or your control over the budget. I want to make the record clear. This is not a Genesee County cut. It's unfortunately the state of Michigan. There's other great places that got funding for the first time. Nation Outside, Come Out, Stay Out. These are also in the corrections appropriations line items, but unfortunately that's the news. That being said, I authored and sent to the board, I had a hand delivered to you, Commissioner Hellenberg as the chair, also hand delivered to Sheldon Neely, the mayor, and I sent everybody here, Crystal, Josh, and Prosecutor Layton, who's also the Corporation Counsel, the overview of what I just told you, the budget that's attached to it, and how I'm going to respond and making sure that we keep operations running after September 30th with that reduction. Oh, that being said, I gave a new contract to be signed by the city of Flint on August 8, 2023. I've been in constant communication with the mayor. We have another call scheduled today at 10 o'clock to get it signed, but as of now, there is no new contract starting October 1st. There is no new funds unless the governor's going to do something different or the legislature is going to do something different. I have to plan on what we have locked in, and that is $2 million. $350,000, as I said, set aside for that tether program. That has to happen. It's only fair for our community. And then the remaining $1.6 million to operate the city lockup for an entire calendar year. I'll end and I'll open up the questions. If we do not have the city lockup, I want to make sure that everybody is aware. From my experience, knowing the population, our jail is a fixed number of 580 people in bed by the state of Michigan. It's a law. I anticipate if we didn't have the city lockup, that we'd be overcrowded within the first 10 days. At that point, there's a public act that kicks in, and only certain people can come to jail. And all the other 27 agencies that would normally take somebody to jail because we have a facility are not able to do that. And they would have to hold them in their own facility until the jail count is broke by the circuit court, the procedure that we have by law. So it will definitely complicate the process if the city lockup is not operating as we have to. But I assure you that if everything goes as planned, we'll continue to keep the operations going, even with our new staff. Moving it over here to the sheriff's office is the key. And once I get the signed contract, you'll get it as well, and we'll go through that same process. Finally, I'm told that we are up to speed on all of our invoicing for 22-23. We have not invoiced for July. That's my understanding as I checked it this morning. And of course, we only have less than 60 days on this current contract. That's my presentation, Mr. Chair.
Thank you, sir. Any questions or discussions?
Go ahead. All right, go ahead.
The only, what comes to my mind is on the overcrowding. And my memory may not be perfect, but when we're talking about in the past, we had extensive conversations about that because of the lack of contract in a timely fashion. But somebody stated, and I think it was you, that that had nothing to do with the overcrowding of the jail. That city lockup didn't affect it. And that was my recollection. Now today you're saying different.
Correct. Because the way the contract's written, as the state has approved it, is the city of Flint, state police, University of Michigan, and Mott Community College all have rights to bring anybody to the jail regardless of the overcrowding. If there was no contract and there was a chance that the board said, we're not doing the city lockup, we're laying off the remaining, deputies, then that nullifies that agreement and everybody's on the same playing field. That's where the additional explanation comes in. So you are correct, but if this is not in place, then it goes right back to pre-12 years ago where overcrowding is overcrowding and nobody can come in based on the state law.
Thank you. That's a lot, Chris. Here's my question. We were getting $2 million from the state. Obviously, that's gone.
We're getting 4 million total,
$4
correct?
million total, and now we're getting 2 less.
Correct.
From that. So, and the 4 million was to operate city lockup, or the 4 million was between the tether program and
Well,
lockup.
the original 4 million was the tether program, the city lockup, and we used to house individuals at other facilities and it would pay for that. That would all be reduced. We don't house people anymore. COVID changed that, but it paid for tether and it paid for the city lockup.
So here's just from somebody who is thinking out county, as you and I have had this discussion before, is so we're gonna take from county budget and we're gonna pay for the lockup, or is the city of Flint gonna actually pay for the lockup and we just lose the grant money?
Well, it's a line item, and so instead of the 2 million additional dollars we had to do all that we had, we only have 2 million to work with. The operations won't change. Instead of them being at Fifth over there, they're gonna be over here, and we will operate the same way, but we reduce our staff. The only way that I'm able to even function is because we moved it back to the sheriff's office main jail facility. So that remains the same. Are you paying for heat? Are you paying? Yes, but that's already being paid for anyway.
So that's shutting down over there?
Correct. September 30th at 12:01, regardless.
Okay, so that,
Yes.
because that clarifies
Yes, sir.
a lot
Yes.
more for me, okay. So, and we're keeping the same amount of officers then?
Up until September 30th.
And then how many, you say?
We're losing 5 correction positions and 1 certified police officer position, which is 6 total.
Wow, okay. All right, so everything's gonna be done in the jail. If
I
we
have
can-
to pivot, correct.
Well, no,
Right.
we've got, you're short, so I'm just,
Right.
it's a lot, and this has been an ongoing dilemma. I can't believe the
Yes.
state cut it, though, that's kind of.
I'm sure they're frustrated about the process. That's what we've been trying to, convince that there's a lot of people competing for funds across the state.
Yeah, but we're a Democrat county. We should be, they're in control. We should be, our funds shouldn't have been cut. I mean, if it was mean Republicans like me, that would have been normal, but, you'd think you guys would have had it. But I appreciate you coming. It's very sad that we don't have to lay off anyone from there, but I'm glad you have a plan. I'm probably gonna think of a few other things that I had run through my mind at that time, but thank you so
Thank
much
you.
for coming forward.
And if I may, Mr. Chair, about 2/3 of the sheriff's budget is general fund. The other third is millages, contracts, grants, the things that we're dealing with right now. So corrections is a main focus of our facility and our operations, but public safety above all, I'm focused and committed on getting it done, provided this board continues to approve the contracts and we get paid and things move along. You do your part, I promise you I'll do my part.
I just, can I?
Go ahead now, Mr. Gunn.
So just to clarify in my mind, I heard you say we started out with $4 million and it got reduced to $2 million. And is it the city that gets that money and we're contracting with them? Or do we get that money directly?
We've always got it direct from the state.
Okay,
The arrangement 12 years ago, with a completely different administration across the board, included the city because we used their facility and it was a partnership between all 3 entities, state, county, and the city. The contract is with all 3 agencies,
okay,
but the funding, once approved by the city, that the services were done, the check and balance, the state directly wires the money to the county. And it
okay,
doesn't pass through the city, it's not city dollars, it's state of Michigan dollars from the corrections line item.
okay. And so,
Madam, I don't believe that that's how that works. I believe
I
the
think we submit reimbursement requests to Vicki over
city
at
pays
the
us.
city, so whenever we're due payments, I check with for to see when we're gonna get them.
Thanks for clarification.
But from the state money.
Correct.
The cities doesn't have any,
They're a pass-through.
yes.
So
Right.
we're in effect a contractor. They are the fiscal for the money that comes from the
They're a
state.
pass-through.
They're passed through.
Right.
And so, that leads me to I heard you say there were other partners to U of M and Mott Community College. What's their share in this? Do they contribute?
So the answer to that is they're just beneficiaries, because when this first came to funding, again, 12 years ago, the idea was to protect the downtown where the majority of the activities were. The city of Flint, the state police, and those agencies along with the sheriff's office do all the policing downtown, minus the federal, footprint. And so we wanted to make sure back then, the creators of this program, that those services will always maintain, even if it's a jail overcrowding. And that was the agreement back then. But they put in zero money, any of those agencies. It's all from the state. The state allows us to fund this city lockup, which again, by definition, is only 72 hours.
Okay.
It has different guidelines from MDOC, Department of Corrections, than it does in a jail. These are pre-arraigned individuals. Once they're arraigned, they're either bonded out, they serve time, they pay their fines, or they're brought over to the main jail facility.
Okay.
So the main big difference is we're changing the location physically, and we've reduced $2 million.
And none of the local agencies are putting in any of that. This is fully state funded.
Correct.
Okay, gotcha.
But we're losing the state funding.
Yeah, I gotcha.
That's good.
As in the talks that you've had with the city, the mayor, has there been any discussion to maintain the 4 million by the city to make up for that loss of revenue, so that or them even working in conjunction? I'm sure there'd be legal problems with both you and them operating the jail, but them providing the lost revenue, means it is for them. If there's been any discussion between you and the mayor about doing that.
So the mayor has indicated the city is not going to supplant any of the loss. But I could ask him again today at 10 o'clock when we have our call. But I'm not optimistic that would happen.
Okay, I was just asking a
Yes, sir.
question.
No, that's a great question.
So just one question, so basically, just to clarify, so we won't be utilizing the lockup at all, we'll just do
Correct.
everything at the county, and the grant that was given from the state, that has that language in there that we can use our facility?
It's in the packet that was sent, emailed, in the actual new contract that states that the physical location is the Genesee County Jail.
Okay, that's fine.
Not to be used at the city of Flint. Again, that was all done pre-budget approval by the state, and for the record, it's a line item, not a grant from the state.
Okay,
This is actually a state line item expense.
okay, yeah,
Direct
I just want,
appropriation.
Correct.
okay.
Any
Mr.
other?
Chair,
Oh, sorry.
Commissioner
Yes.
Lloyd is texting me, he's watching right now in the middle of negotiations with GM, so he's in and out. He wanted me to mention that because the fight previously was over the mayor not agreeing for the county to not use his facility, it's important that we have a signed agreement from the mayor. So he wanted me to mention that.
Thank you, Commissioner Lloyd. Okay. Any others? Okay.
Thank you so
sir.
much.
Appreciate
Thank
it.
you.
Okay, next we move to old business. I believe there's no old, and so next we'll have new business. Resolution 2023-326, approval of an agreement between Genesee County and Evergreen Solutions in the amount not to exceed $32,500. Okay, we have a motion and
Support.
we have support.
Oh, I'm not on your committee, I can't support it, sorry.
Well, then I will for you.
Okay.
All right, we have a motion, support, any discussions?
Next year is a negotiation year. We know that we've got to address wage issues. That's gonna be a major issue, and we wanna make sure that we're prepared to do that as we move into those discussions. So I don't believe a wage study has been done by an outside firm so I always say BF before Freeman. And I guess it would be BG too, right? So that's a lot of years, because Anita's been here a lot longer than that. So it's time to do this.
No questions, discussions, all those in favor?
Aye.
Opposed? Motion passes. No other business? This meeting is adjourned at 10:00.
Okay, we're gonna call the Human Services Committee to order. Roll call, please.
Commissioner Winfrey,
Here.
Commissioner Lloyd, Commissioner Davis,
Here.
Commissioner Shoemaker, Commissioner Ellenberg.
All right, this time I entertain a motion to approve the
So moved.
minutes. Properly moved and supported. Any discussion? All in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Are there any public comments to this committee? Any public comments to this committee? Any public comments? Hearing none, we'll move on to communications. Report from Dr. Hackert.
Ellen will come and help me with that.
And just before she starts, you'll remember that as part of eliminating the Board of Health, we asked that Dr. Hackert come to this committee on a quarterly basis and give an update on what's going on within the health department. She had a surgery planned or some sort of issue at the last month, so we postponed it to this month.
So, just a quick question. Is she gonna do this at the board meeting also?
Doing it as part of the committee.
You're welcome to bring up anything you'd like at the board meeting.
Well, no, I just, when I thought we would do that is at the full board, you know, because we bring up, you know, examples from Commissioner Nolden was alive, we bring up health department at the full board, this is kind of what went down. And I thought that would be there because instead of just subcommittees, so that's
The
just.
resolution said to bring to the committee. This. So I mean, if you want that change, we can work on changing.
It'd be up to Charles, but I think it'd be more effective if it had more people if it was in front of the full board.
Yeah.
You know, I'm sorry if there's, my thoughts on it weren't clear before. I really think it should be, you know, in front of the full board, you know, at that time.
We can work on making that change if that's what.
Yeah, we'll get together and we'll work on that.
It might be easier if I am down at that end, because I am using that part.
Okay.
I'll go down there. Okay, so just a little overview. I don't want to keep it too long, and I actually can talk a bit on things. So I'm going to give an overview this time because I'm not sure how familiar people are with actually what's happening at the health department at all. We've been, you know, we've had a few questions. We've had a few questions, and then it's like not. Like just because we're the county health department doesn't mean we have oversight of everything, so we don't. So I thought it'd be nice to kind of go through the required services that must be provided by a local government, the review of the 10 essential public health services, because those two terms get confused fairly frequently, and then the basic overview of services we are providing, and then just a few of the initiatives we started during the past 2 years, and I resisted keeping everyone here the whole hour. So I cut it off knowing I would be back here soon. So these are the 6 essential public health services, and those are the words that we use all the time. Yet again, I'm going to go over the 10 essential public health services that most people who have been in public health education classes will know quite well. So we are required to do infectious disease control, and that would include tuberculosis, and sexually transmitted disease control and prevention, immunizations, hearing and screening services is a requirement, non-community wells, groundwater testing, on-site wastewater treatment, which you'll notice it does not say anything. So all municipal water is not, it's a municipal responsibility. What we would do would be to get involved if there is a break of monitoring for disease that could be linked to something such as that occurrence. And then food protection, which is a very large category, so I kept it short here. And then I did want to pull attention to this Michigan Public Health Code, because this is one of the problems that you will have seen over the years. This was started like in 98, that they were pushing these things on the local public health without actually funding it. And so they said in the first year they're going to do this 20%, and then fourth year and thereafter, so from 98, it's been a long time. They have never actually met their obligation at the state to give us the 50%. For a while, it was about 23%, until just recently. They're still saying, oh, it's about 41 or 42%, but they have a budget this year that's proposed that would actually bring it up to 50%. But remember, that's from 98 to now, and we all know how bad inflation's been. That's not including inflation. So that's why everyone is feeling pinched and frustrated by the fact that these services that are supposed to be being provided, you feel like you're really not getting funding for them. And it's why it's so hard to provide these things that are absolutely required. And that's only to say it's required, not to say this is all we want to do. So the next one. So this is what Josh had just showed all the department heads, checked this yesterday, or Monday, I guess. And I really liked it because these are things that are actually near and dear to me already, and I have been, since I started, trying to work towards these. These are what I make decisions based on, and you can see the list there. This is taken exactly from what the county had done as the common purpose. But those are also, I could have written those from what I've already been telling my whole department all along. So it is very timely for me to have that, be able to put that up there. Next one, please. So then this is obviously too small really to read too carefully unless you have pretty good vision. But this is the 10 essential public health services that people want to build a healthy community. And that's what the goal is. That's what I'm tasked with, is to get a good public health department that will provide these 10 essential public health services that are critical and necessary to get healthy people in our community. And by doing that, you attract more business to the community. You have numbers that show that. And when you look at our county's standing in public health parameters, it's like we're like 81 out of 83 counties. And that when I saw that, I really wanted just to like skulk away. And then I pulled myself together and I looked at it more carefully. And there was only like 3 things out of like 50 or 60 that the health department actually has any control over. It's actually a county-wide thing, and like it's STD numbers, so we're not doing good with that. But other things that we are doing well in Genesee County is college education, particularly with minority women. It's actually significantly above the state average. So, there are things that we do well, and I was like saying, well, how about that? Like, why don't we get more credit for that? So these are things that are the essential public health services that are. It's a county responsibility. It's stuff that we try and add our health department services and skills and knowledge to add to this, but this is something that we do. That's something that we all have to do together. And this is it's like lots of nice things, very high level, with the goal of achieving health equity for all in the county. But if you start with like an assessment and then you look at it and what do we need to do? We need to develop policies that would meet that goal. And then you reassess it and look at assurances. Is it meeting the goal? And then you find out that maybe something you put in place showed a different deficiency that you need to now address, and that's the assessment again. And so it's a continuous thing. And when I was like putting this on the slide, it made me think about, I had 3 kids in less than 3.5 years. So they were very close in age. And when the youngest one was a toddler, he was very, very active. And so I was constantly just in my mind, everywhere I went, going 1, 2, 3, 1, 2, 3, 1, 2, 3. And one time the 1, 2, 3 and 3 was like under the water at my knee because you can drown without a sound. And so I pulled him up and he sputtered a little bit. But if I hadn't been doing the 1, 2, 3 that fast, I could have had a really horrible thing happen, a tragedy happen. But that's the kind of thing that you have to do here. So it's always 1, 2, 3, 1, 2, 3, 1, 2, 3. Just keep going around all the time. Assessment, policy development, assurance, and you just keep having to do that because otherwise things fall through the cracks. And so that's what I think is a little confusing though, because they use the same term for what we must provide by law and the things that we need for the county though to make a healthy community for everyone. Next one. All right, so I'm just going to give you a little bit of overview of our services, and some of the things I have like one extra slide on it so you can see what has been happening. But I also saved quite a few because I wanted to give you time to like let me know what you are interested in hearing about specifically. And I can talk about almost any of this stuff, except some of those account numbers. So breastfeeding support, that is one of the services we provide for community health. Emergency preparedness, so we have our own person who's a health educator, Ashley Herbig, and she works very closely with the county on emergency responses that have to do with anything with health or water. So while we are not the person's responsible for testing the water or responding to like that would be State Eagle agency. We are responsible and we are making sure that notices that would protect people go up, assessment whether or not they need protection from whatever that spill was, and then monitoring for disease that might be related to it. So that's the emergency preparedness piece on the health department end. And then we have Healthy Start, which is helping pregnant women, children up to 18 months, and then a support partner. And I was asking yesterday, I said, so what about like, same-sex couples, what, do we do? And they said, well, Health and Human Services at the federal level, it's a fatherhood program, which isn't necessarily the father, it could be a grandfather, it could be a brother of the mother, anyone who's a male figure, but they are trying to engage males in this fatherhood piece of it. But they give support through the health services to either kind of couple. So they still are using, that terms, but we do offer that for anyone as well, but the fatherhood program is a male. But it also includes our safe sleep programs in the community and a lot of outreach, a lot of education. If someone identifies either a need or just a desire to have someone talking about it, we absolutely go out there on a very nice quick turnaround. So tobacco licensing, this is the annual compliance checks of tobacco retailers and community education, investigation of tobacco complaints. And so this would be going hand in hand with that new position for the medical marijuana. And
I have a question.
Yeah.
On the tobacco, I know, are they educating on vaping? Or is there anything at the health department for vaping?
Yes, but again, that's something that we really need to get more of because just in the last year, particularly with marijuana, but also vaping in general for the last 5 to 10 years, the statistics are kind of shocking. It was sort of like you were, I was following along way back when it first came out, and I feel like they may have been a little bit precipitous in terms of approving some things because there are a lot of like longer term things that we do see some consequences of. And is it worse than alcohol? No, it's probably not worse than alcohol, but alcohol is a huge problem for society in general. So that's something that we really need to get people educated, and I am seeing a lot of marijuana use in pregnant mothers who have lost a child. So it's something that I think we are not necessarily addressing as much as we can with a dedicated health provider, health educator.
Thank you.
But vaping's huge, so addictive, and especially if you think you're
Worries
gonna
me.
use vaping to quit tobacco,
Yep.
you're not. People are using both, and that's multiple times worse. So, and then women, infants, and children, I will give an individual slide on that. So these are some of the services we provide in environmental health. Our food services conducts inspections, plan review for restaurants, mobile food units, temporary food events. We follow the guidelines that the state requires, but we do the actual services ourselves. And then we investigate foodborne illnesses, general sanitation complaints. I could give you some really graphic detail, I won't. Provides licensing for food establishment and temporary food services. So during the pandemic, right after I started here, I live in Washington, so during the pandemic, I found out that, it was actually Wayne County, I shouldn't say it, but it was actually Wayne County. I was at a restaurant in Wayne County, and I was kind of like shocked at what they were doing with seating, because they had just started opening up and you had to have like the empty booth in between, and I was with a friend who has a lot of medical vulnerabilities, and I said, can't we have us, you know, like this 5 feet apart like we're supposed to? And they said, no, we don't have to. And I said, really? Like, you know, your county doesn't require that? And they said, no. And I said, well, that's surprising to me. And they said, well, you know, they haven't been doing inspections. And so I immediately, it was a weekend, and I called up our food sanitarian supervisor, and I said, are we still doing inspections on everything? Because you're supposed to be doing it. And she said, oh yeah, we still do it twice a year. So we did continue that, and that's kudos, because, you know, there was all hands on deck for the pandemic response. And the same person who is the food supervisor, you may have seen her at a lot of the mass vaccine clinics, so she has kind of like flaming red hair that sticks out. So she was a standout. And so she was continuing all those things during the pandemic, and really, I think Genesee County is doing an outstanding job with this. It's been doing very, very well. We have relatively few food outbreaks that are related to anything that is inspected, so it's great. And then sewage and water quality management, this is what the county health department does. We provide well permits and installation inspections. We do on-site septic permits and inspections. We do water testing. People have to bring the water in though, and we only do it for E. coli and what is the other one we do?
For
I always want to say
water
bad.
test,
E. coli.
partial chem, E. coli, and total coliform.
The coliform, which means stupid.
So 5 minutes left.
Oh.
Dr. Hager.
See, it's good that I cut it off. I really can talk a lot about this. So anyways, we are not involved with surface water testing. That is the state's domain, and we're not involved with like the municipal waters, whether it's, you know, city of Flint, whether it's a smaller city in the more outskirts of it. We do also do body art facility inspections. You might say, well, that's not on that 10 essential or the 6 essential services we have to do. It's actually disease prevention though. So we do that. Child and adult foster care facilities, same thing. Not the child care facilities, that's a state agency that does that, but we can put people in touch with those agencies. If someone were to call, we don't just say, we don't do it. We actually give them the context. And then personal health, children's special health care services, I've mentioned this before. This is one they just add sickle cell disease, so it's a huge increase in what burden there is, but it's a really necessary thing. They take so much of the burden off of our families who have special needs children and adults who have special needs for all these different treatments. While many medical conditions qualify, behavioral, intellectual, and developmental conditions do not qualify for this program. We do the family planning, sexual health, healthcare insurance enrollment, hearing and vision, immunizations, and tuberculosis and communicable disease investigation. Please. Okay, so this is just a couple of the things I plan on next time talking about a lot more of the ones we've been doing, but we have a very nice capacity building for accreditation technical assistance request. There was a free service we offered, so we said, of course, and only a few people took advantage of it. It started August 1st, it'll end by November 30th, so it's really timely. And we're working on that now. It's for the next budget year with the strategic plans. Next one. And then we've also started, because our clinic numbers are down because of COVID influences, it's all over the place. The trend was seen at all local health departments, and part of that is because they started going to private providers and not the health departments, because the larger facility had more transmission associated with it. But also there has been reduced trust in this. So our numbers, when you see like, oh, we had 22% syphilis increase, well, it wasn't what we saw at the health department necessarily, but it is for the whole county, for all the different places that they have been going to. What we have done is to try and work with people, and what they want is point of care testing so that you can give them home care tests. And then we also do expedited partner treatment, and we're trying to do more outreaches in a smaller, more familiar place for them. Next one, please. And then this fetal infant mortality review, which I touched on briefly earlier on, so I won't talk too much about it. But this is a state program that Genesee County had put on hiatus 10 years ago. And I was shocked that with our history here that we were not doing that. So I worked very hard for a whole year to get that already in place because we want to bring in community partners. We have people from each of the hospital systems on this. Dr. Reynolds has been a champion, and I have also been on there, and we bring up things and you take it to the state then. So that's what's cool, because they ask you to qualify. Is it a small cost, medium cost, high cost? Can you do it locally, regionally, or at a state level? And one of the things we just talked about recently, last week, was a really provocative question that Dr. Reynolds brought up that I had not thought of, like, ever. Like, I just hadn't thought of it. I've been on Oakland's FEMA review for 10 years. I never heard them talk about it. So we'll be sending that idea to the state, and I think it would be a really helpful thing to start reducing our infant mortality. And then this is a little cutout because they sent it to me on different things. So anyways, I just want to show that our WIC clients, we are ahead of the state in terms of WIC number of women and children who are using our services, and it's even gone up since last year. It's the federal program, and for every dollar spent by this program, more than $3 in healthcare costs are saved. And that's something that's been going on for a long time. So we actually feel very confident in that number, that is something that is happening with that money that's being spent. We will expect to see our WIC numbers going down, because part of the reason why it went up is they made it so convenient. The federal government said you have to be able to provide this from home. You have to be able to provide it in-home, like a visit, video visit. So people like that. So now the federal government required everyone come back in, and I'm going to be trying to make it so that people can come in, get the baby weighed every quarter, every 6 months or so, but get their food and things at a more convenient time, because we know everyone has to work. People are working, and it's hard to bring their children in and do all the things that they need to do. So that is the end of my presentation.
Okay, any questions or comments for Dr. Hacker?
Good job.
Just one comment. And this isn't, what I'm about to say is not a reflection on the health department by any means, but throughout my career, and this is going back before COVID, but health statistics for this county shows that this county in the state pays more for health care of its residents, and I'm not talking about what you do, I'm talking about everybody, than any other county in the state.
Than any other country. Wow.
By quite a bit.
Wow.
But yet, our health in general, and this is from head to toe as far as in the socioeconomic group, is one of the lowest, if not the lowest in the state. So something needs to change in the county. And so I know that the health department, you don't control everything, because there's a lot outside your control. But keeping that in mind while you're setting your priorities, I would like to see something's got to change. And so I think that you have the ability to do that with your educational background and et cetera. So that's something I just want to say that is what I would like to see out of your department, is focusing on changing those numbers a little bit, maybe getting a little more bang for our expense. And that's taking in people that such as me, that has very good insurance, and it includes people that are on public assistance too.
And your numbers that you're mentioning though, sorry, I didn't interrupt you.
No, go ahead.
The numbers that you're mentioning though, are those like the overall county costs? Like as though, when you look at like the US healthcare costs, how we spend the most per capita of the whole world, yet we have pretty dismal overall health.
Yeah,
Is that the kind of overall county?
Yeah, that's a concept only taken at a smaller level of just the state.
Right.
For worldwide, our healthcare cost, other than one other country, is almost twice. But yet we're very low. Infant mortality is terrible compared to even third world countries. And our perception in this country is that because we spend so much money, we're the healthiest country. That is not true. We're the most costliest. We spend more. We have more fancy machines and et cetera. But the quality of the health of the people is not, when you look at that worldwide.
And so a provocative answer, and not to like try and shut it, because this is really what I am passionate about, that's why I like, total worker health, the environmental health, is that 10 essential public health services to create a healthy community.
Right.
Those are the kind of things that we really need to work on, is we need to be able to have a built environment that people feel comfortable exercising in. I drive by a park like literally every day, and I never see children playing there, because of the environment. So it's like we need to focus on food quality, because we don't have that. We have food deserts. We need to focus on environments that people want to have safe exercise places, a stroll around the neighborhood and not, fall into the sidewalk kind of thing. So those are some things that I am absolutely passionate about, like working with the communities, but it's not something that is actually within my control for that.
Right.
Things that are under my control, I am trying to do. In fact, one of the things that I have been really kind of debating is the pressure to increase our administrative fees for vaccines, or try and get the county to, still sort of fund that. We have the most extensive insurance billing of any county in the state now. You had given us the senior biller position, and we have used it, and so now we've expanded the most of any county by far. We can bill almost every single insurance in the state. But that being said, those insurances still allow the administrator of the vaccine to take an administrative fee. And I have, close relatives who do not have always, $11 in their pocket to pay for a vaccine, but I want to get it. And it's like, well, we have a sliding scale, but not everyone has the same reason for their resource. They don't have money in their pocket. They may have other expenses, like a child with special needs. So their income may look decent, they wouldn't qualify. So that's kind of the things that I'm trying to do, is to actually keep physical costs down. But then it's offset by the whole budgetary constraints of it. So I would love to talk to you about these things and, what we want to do.
No, now it's not the perfect time.
Now is not necessarily the time, but I agree with you, and I'm not
I just
surprised.
want to make sure you have that concept in the back of your head as you're developing
Right.
your plan.
And I do think the attracting people to want to live in the county is huge, and also requires healthy environments and services and things. So that is a big thing, because I was talking to one of the infectious disease doctors, and we were both commuting, for our hour, and I said, well, where do you live? And he's Bloomfield. So he's commuting to Bloomfield to work at Hurley, and it's like, why are we doing this? Why? So that I really love that whole thing.
Yeah, any other questions, concerns? Dr. Hacker, just one thing, with the projected uptick in COVID with the new variant, what is the health department doing to get in front of it in terms of educating the public?
We do have the community webinars that we go on, but the variant is still an Omicron variant, and it still is considered as mild as the other ones were. Now that there are vaccines available, there's going to be a new one in the fall, so we'll be, making sure that that's available. But the other pieces is, like, look at your own risk profile and make your own decisions about gatherings and things like that. But it's really just messaging at this point, because it does not have a different safety profile. We are seeing a slight uptick in hospitalizations, but again, not necessarily an uptick in mortality, because we have these different tools that can be used.
Okay, so are we doing any extra marketing to alert the public?
Just community outreach and, Facebook and things, but it's not something that other places are also doing it that way, because I think in 3 years, everyone has a sense of like personal responsibility, and the other ones never went away. Right now, it's still, well, last I looked, which was over a week ago, but it was still like 15% with that new one. So we may, and we'll have the messaging as people start going indoors more, because that's when we expect to see it more. One of the things that I am trying to get going is a program to put HEPA filters, give HEPA filters to like daycares, like give them the HEPA filters to daycares. And that would counter not only the COVID risk increased, but also the wildfire smoke that we have been dealing with as well. So there's multiple reasons to do that. There's also a program that you can potentially do it based on income and risk factors and distribute those filters for people's homes, but there's a cost and it's not reimbursable.
Thank you. Okay, moving on to old business, no old business, new business. Resolution 23302, approval of an agreement between Genesee County and the U.S. Department of Health and Human Services that allows for the addition of home-based services for pregnant women in the Early Head Start expansion program.
Support.
Properly moved and supported. Any discussion? All in favor, aye.
Aye.
Opposed, nay. Ayes have it. Motion carries. Resolution 23303, approval of an agreement between Genesee County and Beecher School District in an amount of $735,268.29 to provide services to 60 early Head Start children and families. The budget for this agreement will be paid from the accounts listed.
So moved.
Any support?
I moved it
Okay,
before.
properly
sorry.
moved and supported. Any discussion? All in favor, aye.
Aye.
Opposed, nay. Ayes have it, motion carries. Resolution 23304, approval of an agreement between Genesee County and Charles Stewart Mott Community College in an amount of $156,966.41 to provide services to 8 early Head Start children and families. The budget for this agreement will be paid from the accounts
Support.
listed. Properly moved and supported. Any discussion? All in favor, aye.
Aye.
Opposed, nay. Ayes have it. Motion carries. Any other business before this committee? This committee stands adjourned.
We can go into public works.
Ready for Public Works, Josh?
Yep.
Okay. Let's call this meeting to order at 10:33. And let's have roll call.
Commissioner Lloyd, Commissioner Ellenberg.
Here.
Commissioner Shoemaker,
Present.
Commissioner Kuzma.
Here.
Need approval of the minutes from August 2nd. I'll support them. All in favor?
Aye.
Aye. Motion passes. Public comment to the committee. Public comment to the committee. Third, public comment to committee. There's no public comment. No communications, no old business. On to new business. Resolution 2023-296, approval of a purchase order to Flint, New Holland for the fiscal year ending 2023 in an amount not to exceed $197,957 to provide for the purchase of 9 Kubota mowers. The cost of this purchase order will be paid from account 66650.
I'll support it with a question.
Yeah, Mr. Chairman, Barry is here. They actually want to add one mower to that
One more
request. One more mower.
I'd like to make it even 10.
And what we'll do is we'll make sure that that dollar amount is, correct on it as well, but, it's from the same fund. And they've got the funding there.
So you need a motion for the move to the amendment?
If you guys are okay with it, we'll just make sure that it's
Okay.
amended as part of the
Yep.
final resolution.
I have a question.
Yep, go ahead.
Are they there? Do they have them?
They don't have them, but they can get them to us before the end of the year. We were holding off on buying these until the city awarded us their contract to start mowing the city parks. So now that that's all in place and they're gonna pay us, then we said, well, we need to replace some older mowers we have.
Do we mow the new state park here too? Did they put any money in on this fund?
Yes, I'll do anything you want as long as you pay me.
Okay, that's a good job. All right, thank you.
Be careful.
If there's no other questions, all in favor?
Aye.
Aye. All opposed? That's all. Okay,
Thanks.
Resolution 2023-299, approval of the renovation of referee hearing rooms in the Circuit Court and McCree Courthouse.
So moved.
Do I have support?
Support.
All right. Any discussion?
How much renovations are going on?
So, Tony is here, he can probably give you a little more detail, but we're adding 2 referee courtrooms in the front of the court space. And that was part of that reorganization where we're putting some staff who are right now fully funded through the general fund into the 4D grant in his department where we get 66% of that back. And then also renovation of space within the circuit court building, referee rooms there as well.
And now it's just to go out for bid and all the other stuff once we
Yep,
get closer.
it went out for bid and this is the award of that. We had 2 bidders come in, I
What
think.
was the cost?
500,000, he's got the dollar.
Lowest bid was Sorensen Gross at 374.
374.
So then we have the.
Two remodel, 2 rooms?
4
rooms.
4 rooms, so 2, well, and it's not rooms, so 2 hearing rooms, then 2 adjoined offices. 2 hearing rooms in the circuit courthouse and 2 adjoined offices there. And that includes the data pulls, all the power and data lines. Normally we would do data separately, but we asked them to include that, so based on past experience, having that all in one vendor or one contractor to take care of those things. So that is what the cost looks like. The space within the McCree space, our space, is recently renovated, pretty easy for us to go in. The space in the circuit courthouse is on the historic side and is in the kind of more challenging space in the circuit court building to navigate. Lots of beams.
Gotcha.
And there'll be a little bit of additional cost for recording equipment and that, but that'll come later and that'll all be covered with funding that we already have.
That's actually included in this
Oh, is it?
resolution as well. So
Good.
it includes the JABS equipment for the recording room, for the hearing rooms, the furniture for the hearing rooms, and then also installation of cameras and panic buttons for the judicial or quasi-judicial officers for the referees.
Yeah, let me refresh my memory, but the cost recovery from the state on these projects, it's over what period of time?
So this one's normally when we talk about something that we expend in a fiscal year, we get that over the next month. But this is actually due to a fund balance that was created largely in part to increase collections and performance during COVID. For 2020 and 2021 fiscal years, we collected a lot more in child support than we had in prior years. There was a lot of money coming from the government, and we were able to attach some of that. And so that meant that our collections increased. And that created a little bit of a little one-time shot in the arm fund balance, and that's what's actually being used here. So we have a restricted fund balance that was created because of some money kind of that came in and went to families, and there was a piece of that was available that went and was funding money to the state, and we get a little piece of that performance improvement. And then that money is now going to be swept to pay for this. So there's no county appropriation as it relates to this. It is coming straight from that fund balance. So it's a little bit different than our normal.
I was thinking
we
it was a
incur
normal,
and then we get the reimbursement. This is already just sitting in a fund that's restricted, and it's going to be slid over just for this capital improvement.
Okay, thank you.
No other questions? All in favor?
Aye.
Aye. All opposed? No opposed. Motion passes. No other business, and we will adjourn at 10:38.
Thanks, guys.
That-